maiso akwaba Awurade ase pa se program bibiri na ekoso nenso ehiae se enwumre se de kan da bia no ye ba akwankwanu ase ebetie futuo ni akwankyera nyame enam ne nkoa ne mfra so esiesie mai enenso nyame ehyirai pa na ansa na ye be start no Dr. WIAFE mepese ubepunu mu kakra who say also na fe matwa so enti just mute ho na yet good very good and why enough and then menuaba meneno ebe di dwumai hu chia me enye obia se enuaba Kathy sister Kathy ewo New York City na First Ghana enti ye ne ye adwuma tambia timigiri se ebire so a obebem na wabeka me ho na ye de enne dwumadi a onyame asiesie aman abaso men sebre no memma Inuaba Kathy abom paya edikan no amai na odi okasafo mfidie edi ye adwuma ne ne aye baso nyina ahye Awurade nsa tinyame ma umaye mompan Sister Kat mpacho okasa yenti so so all right yakasa mami yentumi mesro na wasumu amai ebreninti na odi mpaye edikan no amai why
ejede form pamcho my mompai Nyankopon ne aba to me
mama
okay cause Kat
Omidewra edumre ya sida ya yeyiye yenkamfo na yede ma wo wode twedru ampon ye twewa ye mpa nhwe da biara da asdankuto na ma ede ma wo se na watwe mu nyina wahwe yenso ena ohomida kronkran mu wode ewra mu asumdwem ne yesi asda enka odin ena wase sa bra bia na wusiesie anepa ema wo ma se be ya ebetimi esiesie ni pedwa ne de ahye odin kronkron ene onyam ebra no so ni o ene edru so mi na me de efo sabre yes strona fe eli program nyina hye wonsa e da wasimpo so me adwen se de enyini kono de benya hode de asom no ba kyerɛkyerɛ na aboaye da biara da ye ho a wankasa wasafo mu wasiesie nipa bebree na amamo boaye wasa akwan no so adwumre wakwa obedi anim ye doctor de na hye wonsa me na me de efo yes so woni hwio wona wo asem na me de efo de o maye na ebesiesie nipadwai na ebenya hode ne de asom no fama wakwa ma onkonkon mashala yesu nyina ma na befa la yi nyina so domu be kyerɛkyerɛ ye adwumre yi o na hyɛ ne wala yesu nyina nua no ma ye nyina yeso ye ho a baabi mo bia kaka wo mo se enkwansuo no bre na so omomra meji ebinom ka ho wala yesu esiesie me program nyina wie peye na nya no nyam hye kese ma wo ye ho Nyankopɔn ewie a ye de asda enika bia ma wo eda wasi enua no ma wo di program yenum nyina no eda otin ye Inuaba Kathy hwehwa wo mo e bibia nwie peye enhye no nyam wo di nti amen
Inuaba Miko MC yeda wasi mami mpacho memo wabompa yese Dr. Bekasa ndi yasisi ohu sedie Inuaba Kathy di fan mpaye mu no ene nyamia ya dompa oyi nakoa Dr. WIAFE Boateng amai Dr. WIAFE Boateng is not new to us what ne abehie mu brebia ye ne benya nkitawudie wo amana ne ha no na one ya akasa akwama na babim ama yenya no se omeboaye na afi onfa adisua na ene die adisua kese pa ebeboaye nyina kamia yese yemufa almost 80 to 90% ye wo ye mpani mfie so se yeni eni yenyini no die na eka yeni anase yeni tisen ono abechirichiri mu na sede ya munim no doctor twini dia wotipa nti wodi brofu femu a uma ne haye na eboa no ma wotimi chirechire ne yememu yie mayen ti ebra yense brepi no Dr. WIAFE any doctor menka no saa afua kasa me kabrofo kasa no a bia na emu bia ante ase ohwe ani oye surgery oye specialist menka no saa for any eho adwuma osaye medical director for Watbo service na hospital no ewo enkran uhwemu pa ewo kasoa echi Budumbura hono efre bi awutu bre Dr. Bechi mu saa kroketwa no ba wo de okase kasoa de penye bra ndi doctor wudru wa na wo de self introduction no ama saa place no minim kakraba no but me pese me mislead amanfo ndi obayi ho di kakra eni ba bia nyame dia ye mosoe ya modernam so provide services to many people all over the world, especially memendafo ne wona enye memendafo nyina. Enti ebra ye to aso no mesre me ma me yentumi. Na wasa bompa yesronko de na onyame akoa ahye urade nsa. Na afi enini sia de ebetie no eye Dr. WIAFE Boating.
Ejede for mama mompai. Osoro ne asase bofo eje nyame wo mada wase. Wona madom ne mobro ho so no wahwe so. Ama na anwumbre wode Dr. WIAFE Boating abeka ye ho. Yesro se urade beka no ho. Nimdi a wode ama no fa no so. No fa ma yen hye wodi animunyam. Yesro utumi ne wadom sebra wo be chechyen. Ma yente wonsam na se. Na urade die be se etimi ye ho ne ni bia me nya ni hwa de ye hunu de ye no urade nka waboa ye otumfo agya ye srawo sai wadom no wahumo bromu wakoa fa utumi kese no ehye na ma ho nkonko no nka samfa no mu ni obeka nyina urade ma enkoye nso yasum na yentimi ntie ni enya ho hyehyeye na moa yensa be ya ye ni ho entichman ko fa ha obi amre ye da wase anwumre so na mo ho nkonko no so na obeka no ho no wahwe no so amo de dwumadi abawie ya asomdwe mo Jesus Christ odemoni ye bisa amen
Ami ntimi ye da wase pa na moma menka we Dr. Bekasa akire yen bes meduanan kwaduanan ne fa chirichiri mu ibenya bre na yebusa yen questions nti bre questions no duro ho a se de ye ne dan no me nua ba kati ne beboa ye ubo din ni bebia wo kasa efra di make note e won nsem a wo chirechire no echiri ehia so ne Dr. Kasa nso a ebe ho hyehyɛ Dr. WIAFE nyame ma ye wo North America Canada ni US anyone a wo tie yen wo amanone ahodo ena yaye krado ye tie wi nyame nka ho na kasa kire so wo bi esese wo to nsa frɛ no a enka akiri wo mode ato nsa na mani pakro no medwo ye doctor ye tie o ndasipi.
Happy Sabbath, church.
Happy day.
Yeah, nyamiasi so amaya kwenye besan ahwe senia awurade aboa yen no ahwe yen so ne bebre atwa mu ni asan be hia afidie yi so senia eldotin kae no mfiri Ghana me ye adwuma wo Ghana na bebia clinic no wo awutu breku about a few kilometers out of Accra. Say oko Winneba. Na sa break Accra, simaka crazy anymore. Mi pesi kasafa adia obia benyi long enough no obefam. So unyia then a coswo when no more. The photo I share this picture. Papa bi asabe na ni Africa Accra. Na nyesa na not here. Bra wadi on the 20s or ya branti one. But time okon na wahu wrinkles ne nema ban muma so ene nema no saa nema nyina na eno so koso o wani mo so wonya na mepese ye hwe text bi elda obetumi aka no twi amamia Psalm 139 verse 14 it says
Dr. Kangrove,
I'll praise thee, for I'm fearfully and wonderfully made. Marvelous are thy works, and that my soul knoweth right well. Amen.
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 At the comfort was now bit me a boy and confidence so. Enyom woha Edria Sankron, verse 14. Okay.
Mpacho Emmanuel Moso ya didi fo was so no mpacho wa atro sam twi no ben obetumi aka twi no amaye. Srem se de elder eka no.
All right.
Uniform Pamacho. O my fire trusm. Na ye mienko enwom waha. Eliasa enkro. Inche modu nai. Pamacho. Enwom waha eliasa enkro. Inche mu edu nai. Eho na watrose. Mida wase. Se woye me ma no eye ehu ne nwanwa. Wone ye nwanwa. Na me kra enim saa yie.
Amen.
Amen.
Amen. Amen.
Na mepese ye hwe photo that's we. So bi person hu sa apple ya. Kwanya sa apple no famu ansa na wa hu no. Ene ya draw no sa no. Eni kosua no ne ewo ho no, ewo out no. Na kese na ayese eche bi sa no. Eye wadwen your brain. Enti bibia upeso hwe no. Eko efa sa system yi mu. Efiene no a na eko akọ wadwen mu no wadwen no akọhoro photo no na saa ba no hu say we ye app we kakra yi kire say nyame a yesum ye nyame nwagwafo up to now obia ntimi and transplant ani eno kan obi ntina mesrɛ mu say yen hwɛ ani no so say dim fie sen yo yen hwɛ so yie because I had to check see already they are chaying. Nema bebre where see se wonyi a eba wani no so. Na efre bi normal vision. Say nyese bibia se mo nanso yenye no se mo kai photo na me de kire mo papa no. No di 21 no ti say. Wonyi no na nema sa o redeem. Eno so nkyerɛ sɛ woyare basesa na nneɛma ɛsesa yɛdi kan a mepɛ sɛ yɛte aseɛ ne sɛ nyɛ sɛ woyare but nneɛma ɛsesa nti for example sɛ wopɛ sɛ wohwɛ adeɛ wopɛ sɛ wokan anaa wohwɛ wo phone so na wonhyɛ wo space a ɛyɛ hu paa wobɛ sɛ nneɛma nyinaa te abom na se wobɛkɔ kanea na ase bi kora so torch so mo hwɛ enye so yare o nanso wadi 40 ɛkɔ a saa na sese ba sese yɛ te aseɛ na ɛyɛ biribi a bɛboa yɛn na ma yɛhu adeɛ awurade abɔ yɛn ɔne no nka sɛ ɛbɛ expire certain time as long as you live no ɛsɛ wode w'ani no ɛhwɛ adeɛ ɛna in fact nipa bebree ɛnye ɛkɔɔ nipa anso ɔmtumi ɛhwɛ adeɛ na nenti a ɛba saa ne sɛ ɔmokɔ regular eye checks. Enti se unyi a na nneɛma ɛsesa w'ani no mu na enye w'ani no nko a udompe mu wonam mu even adidi aduane adidi koraa bi wɔ hɔ a du time bi a wontumi ndi nneɛma bi ɛne nneɛma ɛna ebi nso wɔ hɔ a wɔn sɛ n'ani no ɛɛkɔ anaa wɔnte adeɛ kɛseɛ anaa sɛ ɔmo efili sɛ ɔmo anya yɛfrɛ no mental health issues adwendwen anaasɛ mmɔfra no nyinaa kɔ n'aka ne nko ara aberewa ɔhyɛ akura ase adwendwen ne nneɛma na nneɛma bi wɔ hɔ nso ɛba a ɛhaw no nti yɛsrɛ mo sɛ ani no ka yɛ body no ho nti nneɛma ɛkɔ so yɛ mu nyinaa ɛyɛ as a result of our aging. Na saa lecture yi ɛyɛ important wɔnyi ɔsɛ onyi a woyɛ aberantewa na ababaawa a nso wobɛnyi abɛdu ɛna sɛ woyɛ akwanhwɛni deɛ woyɛ teacher ɛsɛ sɛ nea yɛyɛ wobɛtumi aka akyerɛ obi wo neighbor anaa wo workmate anaa obi na the very common aging changes a ɛyɛ w'ani yɛ saa presbyopia no ne wopɛ sɛ wokan adeɛ a anaa wohwɛ adeɛ a ɛbɛn wo a wohwɛ yɛ apɛ na ate abɔ mu wopɛ sɛ wokan newspaper a na wogye sɛ wotwe kɔɔ w'akyi kakra ne nyinaa ɛnyɛ sɛ w'ani no ɛyare ama nneɛma asesa wɔ w'ani no mu nti wokɔ wo hospital kɔhwɛ doctor no a bɛka kyerɛ sɛ 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 wosesa spares anaasɛ wobɛhia spares but ɛnyɛ sɛ w'ani no yare ɛna ɛfrɛ biribi dry eyes okay mu bi wɔ hɔ a makɔ ne aka kyerɛ sɛ mowɔ dry eyes the only thing ne sɛ neɛ nti a ɛba ne sɛ wonyi no na nneɛma ɛsesa nti production no of the tears no ɛnyɛ adequate ɛna ɛno nso the quality is not as it used to be na kyerɛ yɛbɛhwɛ saa tears no nsuo no sɛnea ɛteɛ na mate ase yie paa na lens no nso wɔ w'anim nneɛma focus so ɛkɔɔ retina no so no nso over time no ɛtɛne yellow na akɔyɛ cloudy na afei koraa na abɛyɛ white cataract no yɛbɛka ne nyinaa yɛbɛkɔ mu into details but the point is say less than 50% of people under 40 years of age use spares but wohwɛ ɔmo a ɛde 40 and above about 90% of them in fact yɛhyia wɔ so ɛde 40 plus nipa sign and a chest space person can there and answer who driver or chest space nipa bebree again visual difficulties na can be no unye no na nneɛma ɛsesa wɔ lens no ɛsesa inside sɛ betumi a bend na a relax no na yɛ stiff okay teacher sɛ unsa anaasɛ wo chest space ansa na betumi ayɛ nti basically no visual acuity when it send out to me one day no cut down up to age 70 na reason they say sa tokro na da wani no bra we are baba wana brante wano light no doso na ye kiti so ko demo na se light ni hɔ a na ebie with time no sa function no so emogo ena omo etime enya normal corrected visual acuity no say unyi a untime ndo 2020 no what I say mo amako eye specialist one mo kan all the way down but unyi no it is space and mouth cry untime ndo ase cry man know how as effect of your aging. And I say about 10% of between the ages of 75 and 80 are unable to reach the 2025 line, that 2020 line. Now, basically, you should not get worried. Now, where you should get worried, say, related to some health issues. Now, very common one, cataract na ete. Okay? Yeah, when you after a certain age, lens, ebesisa. With time, smanya ho shia, let me aye, to say, near you, hey, where ete cataracts. Fortunately, it's me a year operation, kakrebi, Emma, utmi wade. Again, you did say, your members be were move to see how I go through that procedure. Umutimi wade for. Now, basically, the risk factors, UV light, say we are exposed to harmful radiation. Now, baby, if you in tropical countries, Africa and Asia, because there is so much sunlight throughout the year. Now, lots of people work outside, in the open, fishermen, all those, the age at which cataract instead of being around 60s, 70s and above, your starting in the 40s. Okay, and sugar also, so do a secret area and also maniba them. Now, use steroids. Now say it to me, use steroids for never be brave, asthma, sasabro, any man for any crack cow, now use steroids. We use it for a long time, which means to develop cataracts. I can't diabetes, so what's them. And the second one, another group of eye diseases that glaucoma, and also you can't have them that and say pressure no when you it was too much. My nerve now a day message fit when you echo brain on a home in Fitiasiano. And to me, say, now eventually not the communicate with the brain to me what here. Now nipa bebro home high risk. Age another one. Now send African Americans, would be 40 years and above, you stand a higher risk. And now with the 60 stands at a much higher risk. And now so obusiamo obi eniefra because of glaucoma, you actually stand 5 times more chances of developing the glaucoma. And see, glaucoma Oshe ani haya fita a photo ya. And Nifano, which is Benkum, the left hand here normal, but Nifano. On side kakra and people to put to so kakra left one. Now we check it the pressure and so I don't say pressure and was through. Now basically a pressure a walk and a build it up to the point say Nuanindrono it means signing call nerve na a day message fit when he cosiano a call what dream now, glaucoma, there are no early signs. I mean, when you know cow and when they come out during the early days. And in fact, say hospital now you check out now suddenly you say BB wrong with the eye. So now picture na share no start with wani baako na chere eko baako no so nti best stream say bia was risk groups na yakeka no we are African where the 40 and above say oko for review oko and check here it's your right wait me catch a doctor and say ubisa no say pressure no so you know normal no range from 12 to 21 millimeters mercury. Now treatment eye drops we use a BP a draw, hypertension a draw, and diabetes a draw, and asthma a draw no for life. Sana eye drops you have to use it for life. That's an responder. There's laser surgery and regular surgery to create a bypass. Senior sooner I could know when you bet me a tremor temp. Now say I'm saying more than what it used to be 20 years ago. Because I sound so beautiful more where the 80 90 2 weeks ago the patient be the 100 or didn't 100 birthday by 2 days later it is a film. But when you huge numbers now formally no now it means say age-related macular degeneration here abrofo nkwana eyom but actually who say quite common our Africans so basically no sana patients no what age-related macular degeneration no at first no or share or kind they obey say lines no I say waves so on my left hand side no sana are there now eventually no I say I did be to akata mfimfini no nema no nchen kwa no oba obe kanchiro say ontumi hu nipa anim jina so na ade a common ewo continent Africa na say now macula no center of the back of the eye now sa degeneration no it say sa area no destroyed for some reason okay photo now right hand side no let me manifest it to say some white dots and I say atrophy there's no life okay now small subretinal hemorrhages can also be found there but the main thing we need to know is say macula no which is the central part of the retina no which is responsible for sharp detailed central vision no eno na ehu etuchima na normally no who says central vision no nema bafo nim ne once I said it be black abekataso na peripheral vision no nema won channel tie clear hu bibia but finfin no na na very common. The highest risk factor age. The age again. Now additional risk factors here smoking. Smoking issue. But we should know that there are passive smokers. You now smoke, but you are in an environment. Environment we are man for smoke. Smoke. Family history. Say obusiam obizu ewobia maybe obesity now race now say white people have a higher risk factors risk of vision loss from envy than the others. Prevention avoid smoking to reduce risk, maintain a healthy weight, then regular check-ups especially with age, then you eat a balanced diet rich in green leafy vegetables and antioxidants, which are is a message that comes across everywhere nowadays. Okay. Basically, treatment, use of vitamins. Now, laser surgery, which is not common in our area. Injections. Now, the injections are available, but they are very expensive. And you'll be able to afford. It's our only bet. They say, go back to Eden. Eat a balanced diet rich in green leafy vegetables and antioxidants. Maintaining a healthy weight by exercise. Remember that new starter you come as regular checkups. Early it can be detected and then something done about it. Some facts so many times, but a very important say just by changing a lifestyle can make a lot of difference in your life. Then diabetes. Now, diabetes also to me man for blind. At one point we talked about it, but our diabetes are those who actually develop diabetic retinopathy, because what happens is diabetes, the vessels, your blood vessels, your periphery, and now the risk of diabetic retinopathy increases the longer a person has diabetes. And it's a very clear say. So when you are diabetes, now your chances of developing diabetic retinopathy are very, very high. Now, the key in early detection and management of the diabetes is very, very important. It's true say we drop Nanso the level of our blood sugar. What I say? So it's the same mechanism it's me trap nipa nine because of diabetes. Say money crophobia 9 because 9 pro. The same thing. And then also it's me AC photo big or have the lecture. So photo now right hand side. Normal left one. Now right hand here diabetic guy. And never be bread me see more. Go mommy sign said there's a problem with the person is a 1 or diabetic. Now 2 or cotton wool spots exodus. The blood vessels are leaking. Okay? Leaking. Emma is sanifa the walls no now very white dots now. And I say blood and cancer to me back. And I say Moho beans and cats here, see the roots, I say, Anna, popo, a poppy or small blood, nodules, be I know to me pie, I'm bleeding abandon so. And I said, small blood vessels, not to me, if you free, a back, sending a back horse when Okay. And ade humpa to be diabetes I say bosume bia na check it say very place here draw no na fe share ni wo ma hwe wani na utime again this one say ma hwe mani because baby I want CCI so surgery I see a call home bibia ni boy dey papa it was that stage so the outcome not yet very encouraging. And in a restaurant say again, best bet. They say diabetes the Sremara Mundi Brano again, we come back to the diet. Okay, and here papa. Say a quantifier temperate, a friend of temperance, yeah? How to eat as a diabetic. In this so. Now, number 3, exercise, very, very important. And again, say diabetes no echo when in early stages no their own tissue. A doctor no or show when in more no who say baby started. Now, very important say if you call so because someone dry no I show you show when in but basically no say who started say vision blood. And now who said never be trouble and in the society diabetic. Now who some dark spots. The settlement nasty. Got nayan show. Nayan SSA. Treatments no basically laser therapy. And your panebia bonus surgery. Surgery no outcome no yet too encouraging. It's our best bet. And instead, we maintain blood sugar level and blood pressure and cholesterol levels and so normal. And regular eye exams in Ghana no you month over every month. Smoking never help you. Okay. Now, tomorrow, very, very important. Say what diabetes regular routine exercise is very important. And now you make sure say you don't go near anyone smoking or anything. And then the exam should be thorough at least once a year. Okay. Now there's another one which is also becoming very common. A friend of dry eye syndrome. In fact, tears, Nusuna Ewano, Shedanam de photo Yatuha. There were 3 layers. You may not believe it, but there were 3 layers. There were outside crown lipid layer. And I say Nku Anas Rade, then aqueous layer, then mucin layer. Aqueous and the mucin produce some food, nutrients, and other things for the eye itself. Now, with age, okay, tears can evaporate too quickly because the quality of the tears not yet papa view. Such as a gland view lacrimal gland. It's mean produce MSS produce no. It's quality no ye papa. Dry eye no timima time biana when ekikawa na yo hine ana on say normal. Enti nya mesrem no say yen hwe yen hosu ye say ho na say when kikaw ana show corner test it and show you. Let me test the quality of your tears. I say I would draw the supplement yeah. Now, interestingly, they say dry eye syndrome is found more in women than in men. Okay. Now, dry eye syndrome can develop at any stage of life, both young and older. But the older ones is more prevalence. The prevalence increases with age, making it a common condition among other older adults. Okay? The quality of the tears and then the tear production is actually a more go as you grow old. Now, it's a dry eye syndrome. Basically, what is when close to background, and I say, who feels that when I dry, I irritated. social contact lens and TCFS no. Now, light bar, it takes some time for you to tolerate the thing. And then time you I see when you know a brain. We have some burning sensation. But natural tears or artificial tears is the way to go. And there are several options here that you can get. The Emma when you know replace it normal tears now. Now was is here and or outside extreme sunglasses and I was space fashion and no Emma protect you from so many things. At a certain time, and then to me do baby doctors let me reach your limit. Okay. Now at that condition after surgery, after glasses, still the vision is not enough. We call something low vision. Yeah, and on the diagnosis of people with low vision. Now, almost here visual assistance. Okay. Now, quick example. Yes, will be a very, very short sighted. Okay. We in a space the space manner never clear. Okay. But low vision, conditioner, say all the glasses here and to me satisfactory reading, contact lens, nothing, medication, nothing, surgery. So now, sir, I did to me impact with the people's daily activities. Okay, on to me driver, say a teacher. This time on to me kind of very frustrating. Imagine say, oh, on to me kind of debut. Okay, and I won't hold the pine papa. Yes, or Casa and San Abeti. On to me grand one animal. So the side in a low vision. Now we have there are so many causes: diabetic retinopathy, glaucoma, and macular degeneration. So usually older adults get to that stage, and we actually request that people get an appointment to see a specialist who be a specialist in that area. Prescribe special aids. We call it low vision aids, a magnifier, and electronic aids. And say TV, computers beat me. Yes, I ukasana a producer, in large prints. Senior with me, and these are some of the low vision aids around this here, magnifiers, telescopes, name it, some computers, now some small glasses, it's me never way to about closer, so that at least the person can move. And I say, share magnifiers now, it's me a kind at there. Now, large prints. In fact, another example here, there are large print Bibles for the elderly. Okay, but the message today is there are two types of these. There are some things that happen as you age, which we consider to be normal. In fact, so be the 45 with the 50 now ultimate kind the Bible without any help. Or no mom no problem. Okay, because at that age, you are not supposed to read that because that's a normal trend. And so be able to read at that age and not just only short-sighted. Okay, to me what they were close to them, but about their way Timothy Manube see her. Now, if there are any questions, I'm ready to see what we can advise ourselves. Finally, the American Academy of Ophthalmology recommends regular eye examinations for older adults to detect treatable conditions. And the time you have a home physician, or catch say, this at that time. Now, if they're examining you, you should, and they don't examine your eyes, you can demand, please. Asymptomatic or normal individuals, age 65 and older, should have eye examined maybe one every 1 to 2 years. Okay? In fact, a mouse spares at my clinic, a mouse spares for reading. I say, latest in 2 years' time. Okay? For us to check again. Because when you know, many times, the man for say glasses I expire. I disagree with them. The glasses do not expire. It's your eye that is changing. And then those with symptoms should seek attention immediately. Say, be suddenly, say, now, when you know to me when they come up, you shouldn't sit at home. Please. Now, patients with known eye diseases should make sure they are under some care. So, glaucoma, now diabetic retinopathy, and now dry eyes, make sure you are under somebody's care and they are looking after you regularly. Pacho Manoisi, any questions?
Yo, Doctor, agidifo nyinaa de Nyankopɔn ɛda wase bebree. So ɔbɛboa yɛn saa. Sɛ yɛnim sɛ yɛnyini kɔ anim no deɛ, na nneɛma bebree sesa ɛwɔ nipadua no ho. Yɛda ase bebree. Agidifo Doctor Nani asi sɛ ɔkaeɛ no, ɔse yɛnyini kɔ anim no, ne yɛni no ho nsɛm na yɛ bebree. Ɛni nso deɛ yɛnim sɛ nekuta nipadua yi. Na no asi deɛ wokyerɛ too hɔ, deɛ wo adwene mu biribi a ɛha wadwene wɔ w'ani no. Ipatwa wobɔ wo din a na waka baabi a wɔkasa firi no na ade wasɛ bisa na asɛ ɔmo na ba doctor yɛ ready so bɛboa yɛn meda mo ase. Yo doctor mpatwa obi ama yɛ a cat ni bikasa firi New York bipatwa na wɔka na wɔka ice exercise sɛ yɛyɛ exercise no na mentini ho sɛ ayi physical exercise emema nipadua ni nyina na wo kana say a particular exercise for the eye a wo be kire yen.
Okay, both. But physical exercise because obesity leads to so many things. And church or new start no exercise the same exercise. And any exercise use computers. Okay, if be 20-20-20 rule. Okay, so we share computer for 20 minutes. You should take a break. Look about 20 feet away. Look far, just for about 20 seconds, and then you get back to your work. Okay. Very, very important. Again, Boamasa dry eye syndrome, no? So, the symptoms, no? And you have to be drinking lots of water as well. If you are in a baby, I want Ghana, a washing the office, air conditioner, or on a computer, and say, and time so now 20-20-20 rule so in this no. Thank you.
Yeah, and that's a great doctor. But when you maybe are ready, no bet me they were saying bisa aba obo odin no aka baby a wokasa free. Da mo se. Yo. Ejidi for baba mo aba doctor cat ni ebio. Ipatwa na wo ka early check up no ho asem say be a 45 to 50 no. Na minimum be a would 50 ya na ka say oh would 50 ko dia so hwe wani no ho asem. Enti would 50 ko no okohu okọ hospital eye clinic am kasa. Ya ma no glasses whatever. She said doctor check in no man be glasses ya no use bibia kama. But only kwa ni mo no do to say the 60 something ko 70 ho no. Na fe na no ye rough. Or they call hospital and let's talk who the eye doctor no the eye doctor say say will develop a catlas.
Yes.
They could do stage be a let's say or corner no surgery on it. Na eso no was start early checkup na I didn't the man ebasa.
Well, cataract no has because cataract no lens no the only tissue in the eye that grows throughout life. So that I say, as you grow no and after 40 years no obia here reading glasses. Okay? Now there's progression of the cataract. If started in chain, then it comes to the center. Okay? Now, first, let's start here a yellowish. But many patients no bow say, I see no money, yellow pizza. Okay? With time, no. Now it continues to increase. A symptom, gradual loss of vision. And yet, that's the correct age of develop cataracts. Now, opia develop because the lens is growing. And now, also opia lens out. What happens? Say a packet, the old ones no packet in the center, and new ones are developed from outside. What I say?
Yes.
If you are cataracts to me do say white say. But nipa bebre no and do this white, but a disturb the normal activities are on the end because they do say sabi call baby surprise this will be so inside the call. And we have penosa. Then I say at least every 2 years. I so corner show. Oman show Oman full examination. Ultimate demand. What about this? Okay, I don't think I church Musani.
Doctor Eda say.
Again, cataract not to say John gray hair. Okay? When you train on that and also eba. Ushen yo ho cry besamba. Anambo. Time no do. Time no do. Ukwana doctors no be huni. Fortunately, cataracts no de it miss ho yare. Aye lens no. Aye gray no fi ho na the artificial lens a cheho. Na wanto.
Doctor Eda Sibre. And you for me pam so ya do so online so anyone some na ye can know. Any no de kusa ni pedua ni nyina mesem bebre. E ma ne how fa wasam bra na doctor nchechire mu e ma yen na be boa yen nyina. Je bre wo ho.
Doctor,
So obo ni anu aka be bia
it is Paulina, Jeffrey, make us up you go down. If I show what causes ATI, we'll hold yours in a knee and in a nick can. What's the cause of that?
Okay. And Kikano. So many causes. The common one here allergies. Allergies not to say asthma. Okay? So be any ehone be share. Now I started reacting. The most common reaction of the eye here when I kick out. Kick out so man said in brown. And a seasonal. The sense says spring bay summer. The spring bar brown shrine in my baby and I say gun and so started to na a call Hamatan more. Where's so much of those dust man for be brave about that condition. A draw where the mount aye. But say but and only the most common cause allergies. Now be some power so you in the family or not so allergies. It doesn't have to be when in a rectal be asthma and an hockey cano. So you has some now and perfume be and be something no only allergic to. See, Senane Kikana, so uncle clinic na yanko sheno na there's something to do about it.
Okay.
Sister Kat, Pacho Lotini, person busa question.
Edam Pacho, Obodin, or Wabodin, the Bank, baby, I walk as a free.
Kasa free Toronto, Canada.
Pacho Casa.
Dr. Mu Yedasipa, my question, Edwasi for Niema would above from regular eye check between a year or two. Now, what can balance diet and so? May GD say, ye son sense where mate be there, ye didn't know where ye say, and Niema would they come with Diana Hua, a ma a boa weni, a bit is a benquire and answer and wo, and carrots. And obo leafy vegetables and so. San seminal at the same. Pacho, with me a boy kakra. A fair Driani say they maintain. I can balance diet no.
Sure. Why are they elder? In fact, a very, very important fact, a boy and then throw one. And only a Diana and number, and no necessity. All these others no came as a result of the flood, but God in his wisdom, when he created us, he gave us what will keep us well. And saying, Habai Abaye a draw. But as I say, Jenny, any specifically na meba children if be vitamin A deficiency. Now, some vitamin A deficiency no as a result of not enough of these vitamins in the system. Now, vitamin A no is rich in carrots and red palm oil na okay, which is very, 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 very common in our countries. Unfortunately, sa nema very healthy, no. I cash crops to the point say kwashoko actually a Ghanaian word, okay, because mofra no yare kwashoko traditionally obetumi aka kyerɛ m sɛ yɛdidi a ɛtumi wewe carrot ne rɛwura no. The only green vegetable I yɛdi yɛ kontomire, and kontomire no koraa yɛ seasonal. That's the only green leafy vegetable. Nti ɛsɛ sɛ yɛhwɛ so yie papapapapapa because mmɔfra no anstarte on a good note a wonyi it will still continue. Now, I was shocked. Say, as late as I think a year or 2 years ago, obi de abofra bi ba in clinic na ni kosua nani nani because or lack so much vitamin A. I say poverty amidst lots of abundance. Okay, the sense and go very cheap. But then some fast foods, all those na veggie and some. Our for vegetables called good chain. And see, very, very important, still valid. vegetables, seeds, and all those also help in the maintenance of the body. And the eye is no exception. Now, if at all possible, let's as Adventists go back to Eden and promote this to our neighbors. That's all I will say about this. Elder, I hope someone answer our question.
Dr. Medase Papa Medase, I am very well covered.
Sikanti amanfo omo dua carrots no kra obekọ akoton market. Omo dua nyadoa na obekọ akoton. Omo dua cucumber, all those things on the market. Now auto biscuit amani buy biscuit name malt.
I'm cutting me some question quick.
Mipacho opening pacho ma 1 minute one. Dr. Mpacho, I add a question. No, bisa abenkwane ngo ho asem. Na this time no ya na ye go for can say. And I want my cholesterol and I yes in terms say no a hon doctor either bisa hon to hit ho kakra ma na or asan opening abem.
Yeah, Pacho, with lots of these cholesterols. In fact, there's so much happening nowadays. There's another theory that has come say cholesterol. It depends on what type of fats you use. Okay, you use all kinds of fats in the system, but it has been proven say coconut oil, shea butter oil. These are our olive oil, which is not common in our place, but the what palm nut oil, much healthier than palm kernel oil, but unfortunately, you use more of ajungo,
Yeah.
Koto bibi the ajungo na bechi, ango.
Okay.
There are two different things. And in fact, a very, very important say because lots of SDFS and Krakow, but lots of those fats are chichi nema or fear that healthy. And Mr. say vegetable oils. Now you was so much. Someone said shea butter yet made the chick very healthy. And so if anything at all, rather than going for oil now, I share bottle money now, just let's go for our local one. We have the coconut oil. We have palm nut oil, which is very easy to make, even at home. Kasi mami abenkwanya or saucer and palm oil. Yeah, the vegetable oils are perfect, and yet the other ones.
Dr. Edasi. Opening pacho bodin the usre na service anaba Edasi.
Yo, make us afraid, yo. Doc, na me sound.
Opening pacho wa bodin
Derek in here. If person me who said yeah, na also glaucoma. Na it's cure. Emma ya na.
That so abisasa asemi glaucoma Arabia make us a genetic running families and for some reason Ghana ranks number 2 in the world. Now the number 1 is St. Lucia, the other side of Africa. The slaves now they want West Africa call on a day because they have a concern Black Americans, but the main reason is the production of the aqueous and the outflow and balanced. See, there are so many reasons, and all as we grow old, the prevalence of glaucoma is higher because pumping Number two, answer now. Glaucoma is not curable. You cannot cure glaucoma, just as you cannot cure high blood pressure. You cannot cure diabetes. You cannot cure asthma, but you can control it. Key in early detection. Say, then if they were to a draw, so the draw has to be for life. Just as due to high blood pressure draw, you have to drink it for life. Mistake I move brain and say, oh my brain, you know what? I don't know something. Oh yeah, been so intimate church and senior a dear drone so in the sun. It's Miss Santa addresses a deep bosumen on that in 2 weeks or 10 days now, sir. And if it's true, say a castle glaucoma, you find seriously because damage intimate recover a nerve damaged, a nerve near damaged that intimate and reverse. Unlike cataracts, you go a tenofio, the artificial lens and what you want, glaucoma and tessa. See, a case or glaucoma, and I can in my talk, no say. Say, or busiamuna or glaucoma, you stand 5 times more chances of developing it as you grow. The patients, yeah, diagnosing glaucoma because a patcho, catcher or many free. In fact, Ghana, glaucoma can blind somebody at the age of 35. Okay, that's aggressive. It says, the Casonfa or Mapusiafono, Embra, Yebe, show free. Senior, I bet me detecting early. The danger of glaucoma and subion say, Estatia on tishi. Yes, we want to see there be. Estatia with one eye. See, just accidentally, we be told any eye want to know so now. Oh, Katana, Opusa, don't say where I see. That's when people come. By that time, that one dead. Now I almost gone. Until next term, say once you pass the age of 40, because you may check you for glasses. Then if I want to check you for glaucoma, on the shaman, then they will advise you what to do next. Elder, answer our question.
Thank you so much. Now, the question is recently, me a blind, not in me. But according to more they say Ghana, ensure no more than woman, a consume more damage. For me, and almost any the minimum of room, so a true. Since you no more say no people and na damage amount for any because first na who be a handle brand if I one but and then I said too much okay nipa 10 be a bear 4 or many fra true so dog jari pay the woman problem
in fact the effect you're starting here malformations. Okay, when say I work for Frebia and any back on what I say. But glaucoma when the has been there, so I'm Ghana to number 2. The reason is that say yeah detect ya mafu hwa maso mbe say oh and glaucoma so I want to say way bad and normal until say very late. And And no, I will not say anything about it. The only time I can say, sooner I pollution no, it started causing malformations in the newborn babies. And we've seen children who have been born, one with either a very small eye or no eye or something happening. Okay. But the glaucoma thing has been there. Social symptoms now. It's silent. In fact, coin tree language, we say a hint and fry. I bound to she, she, no one say, Ukatonia, say, a cop. Now pressure no so, so papa. Then can pressure no normal no ready from 12 to 21. But saying who is so because 60, 40, 50, you know, and so yes, it has some effects, but associated with the glaucoma and these cataracts. But otherwise, glaucoma has been known to be in Ghana. Ghana ranks number 2 after St. Lucia in the Caribbean.
That's it. In fact, be for flowers in Bisa, obetumi di aba na doctor aboa ye nyina. Ubo di ano aka baby a wakasa free. In fact,
Mepacho Olivia, mekasa fi Cincinnati. Pacho,
Mama Pacho ya anti udi no baby a wono.
me say Olivia ni, mekasa fi Cincinnati.
Mama Pacho.
Mama Pacho doctor say cataract and glaucoma no difference bene wo. Menim say bi di kan actually.
Yeah. But your difference can see one. But first, man, can't similarities. Maybe attack it for. Okay, of course, glaucoma and cataracts and so my friend will have the warm. But the main thing is cataracts affect a lens in the eye. A lens in the eye. Okay. Lens a white eye lens whereas the glaucoma affect a pressure which increases in the eye. The pressure increases in the eye. Okay. And pressure no increases anymore. Then the nerve I send a message from the eye to the brain starts dying slowly because it takes time for one to develop the glaucoma and then become blind. That's why the visit to the doctor is very, very important. So that if it's detected, steps will be taken. Senior bet me I lower pressure. Okay? Pressure no lower. Then a friend said pressure no buffer, then the damage will stop. Okay. Cataracts can be cured. The sense that once surgery is done, the cataract taken out, new lens put in place, the person is back to see. But when one is blind from glaucoma, you cannot make him or her see again. That's the main difference. And Timfacho, yeah.
That's why that's it.
All right.
Glaucoma no are more serious than cataract.
Facho you.
Yes.
In fact, Ghana survey we discovered almost 1 out of 5 blind people are blind from glaucoma. And cataracts, about 60% of the blind people are blind from cataract.
That's it.
I'm sure. Albert, yes, Papa. If I saw body na kabe we free. That's why about
Your Penny Derrick from New York. Don't person this as a creams that you use, body lotions that you use, you know, a bit to me affected ye niana. Because in Kuno and a second, ye may near your nom. And near my eyeshadow, I would want a real mode, yes, I will a bit to me, I cost to be Diana. Two questions, no.
So you, the body lotion, no, again, it will all kinds of chemicals. We can about allergic conditions, allergies. You know, be why need be a home here and share. And let's say we should try to abstain from this. And a lot of them also have steroids now. You can watch them. Indirectly, it can affect the eye also. But when it comes to these eye shadows and eye things, the same thing, allergies. Okay. Now, I recently had a case of a child because he has been seeing the mother doing it. He took the glue and applied it on his eye. So the eyelid got stuck. Okay. And we had to use other things to make sure we bring them apart. But there are chemicals that are applied there, and the only advice I'll give our young ladies is we should not try to help God. He's all-knowing, and there's use for every single thing that He produced, both eyebrows, because you find people actually practically shaving their eyebrow and then putting a pencil there or some paint there. Others extend the eyelashes so much so that they look like caca. But the whole thing is that there are, because for that extension to stay there, they use some glue, which is a chemical, and sometimes it also drops in the eye if they are not careful. And so it actually brings some burns and allergies. And so I would discourage anyone trying to help God make them more beautiful.
Sister Kat Mpacho Edotini, Toronto, December Subim. Doctor, the question I'm pressing boy kakra, what can I dry eyes? Na menimse mo amoye ni ho adwuma na mu ni kase. Yesu so na yenyini ye ne se efre bibi pink eye. Na pink eye no so eba ehia se wokuni pemu. Se wo bo ho adwa kakra. Eno die ne de ba na eba nso a aye nokre se wokuni pemu. That's
actually, yeah. Elder, a very good question. Pink eye no basically conjunctivitis, but a viral conjunctivitis. A sunny temptem. Example ya Apollo. I think Obianim Apollo. Okay? Because a virus, no. Antibiotics are a common idea. Would it be Biaya and what? And see, what we try to do is the people to keep themselves isolated. Pink eye, I know to say flu. I hope you understand me. To say flu. Sunny. Difference between that one, bacterial conjunctivitis. A bacteria, no, it comes with pus. When it's when you na atari, this one, it is the pink eye, viral conjunctivitis. Again, certain times of the year. when flu is around. And we request that when it happens, you keep your hands clean, the face is clean, face towels are isolated towels, pillowcases, and here is very possible, but back at home is very difficult because maybe there are 10 children, the parents, 12 of them. You think the parents can afford 12 face towels for all the 12 children or support? Everybody uses the same thing. And so it's very important when we have those pink eyes outbreaks. That's why children are not allowed to go to school. But most of the time they bring that pink eye from school to infect the others at home. So isolation is very, very important. It has its own cycle. That 10 to 14 days it will disappear. But before then, if you go to the clinic, they'll give you something to bring the symptoms down and then make sure the person is comfortable and that sort of thing. But the pink eye is actually viral conjunctivitis.
Okay, Dr. That's it.
Say, Mate Apollo Kanda. And pink eye and cheating.
Okay.
Hello, Asgard, hello.
Mpacho body ne kasa baby a wufre ka baby wo.
Ba no makasa nti me bia ne bitwato dia. Me sa doctor me se bia kan ha sam bia. Se doctor obi ni na sorry bia onya be 70 plus na ko ma so ko the doctor no say obe na ni surgery. Ko ba recommend and I say bia onko e bi ha so onya bibi dia no be bo no ti ni ani pro bia no be bo na chen so be surgery. Ko ni fi no. Ano ho na me din se sei. Yeah.
Pacho, to give you an example, operative will be already 92 plus pain. Okay, so a cataract, very simple, very straightforward, and I think a cataract, I know the a bebuano, okay, because what do you know? Obia sori ana pa okona dwuma kodi ne pa aka ne kwa ofie ontimi nko bia enti na mesra ne say let's encourage him to go and do it at that age, you know. Cataracts no say am kind it is John, okay, gray hair, just a two and a shots, you know. Cataract ne ko profile ho ne de foforo lens foforo ahye ho am obetumi ho ade kama nti me encourage so obeko say cataract kwa ade ai
All right, that's it.
Yeah. And yeah, Dr. That's it. And you for me permission, yeah, no aso nti se obi ani ase bi se bia o hobi mu dia Dr. Mpacho meje chira ma ona dia odi ama ye nyina ye ni aso ba obeka ni nyina bom na afei afutuo kakra wo a wode be ma ye no wode ama ye ansa na de dwumadi na ba wiye.
Okay, me that's it. Yeah, me say any no very interesting and I'm a boy in a way or per se PPO de my it's Andy Breno in full. Okay, I say first we now there are some things that happen. Say yes, that it say a bo akokra na everyone normal. The first thing here say okay idea. Udipcha Fabiama one chest space and not just so yare. A normal aging process. Another one, say okay, definitely. I don't expect to be already 65. They can are there the same level, so be already 20. Okay, maybe I may say one or two things. And yet I say so young shishu. But so after that age after 60, 50, 60, 70 would develop cataract and glaucoma and SSO we are very diligent and ma enyewa so de so pese o mpese wani hra enti ubeko na ya ye surgery say cataract ebe o surgery glaucoma ebe ma we dura na ebe o bibi ama pressure na aba form diabetes no so udi imrana so diabetes for omo mra ide ama omo duane a obedi exercise ene nema bebree ne a ɛsɛ sɛ okyire ɛnsɛ sɛ woma akɔnnɔ deɛ ɛha wo nyɛ saa a yɛbɛtumi atwa wo nan na afei w'ani nso afiri aka ho because ɛyɛ w'ani no akyi no saa diabetic retinopathy no ɛhu paa ebia Canada ha deɛ ɔmbɛtumi ayɛ ho biribi but Ghana gye sɛ wowɔ sika paa nsa na wobɛtumi na surgery mpo ɔyɛ a outcome no is 50-50 be basa. And let's say prevention. How do I remain healthy? Now just quoting elder, okay, let's go back to Eden. Okay? So we are secret, so we are now yeah, let's go back. Let's improve on the vegetables, the nuts, the fruits that God provided in the Eden. And let's not forget about our regular checks. Once we're 40 and above, I would suggest that every year also be showing. In fact, my practice, every year, every nipa 5, and I pass on be showing. And I would want to see that culture improve. So be kwakoshe senior wapomti. And see when I cram the beja, especially say when he free back, very important. And some messages say okay, it's more fun share, fun share with others. Oma year juma, Oma kwa sorry our man tisadi, Oma kwa sorry for fro, share my yeah. See, when it cram the bedroom, happy Sabbath.
Happy Sabbath. Thank you. Amen.
Amen. Yo, I did it from Pamtomo Bienko. Sabrina, Beja Tree Ama Edo.